Morning, everyone. Thank you for joining PHCA's webinar, Improving Quality of Care Through Technology. My name is Abby Foster. I'm the Director of Marketing and Member Services for the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members for NAB-approved credits in order to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and gain a better understanding of practical application tools to equip our members so they may continue to provide the highest level of quality care possible. The objectives of today's webinar are to understand the drivers of change and the evolution of senior living, understand how technology can be leveraged to identify and improve quality in senior living. This webinar will be recorded and made available on the PHCA website following. It will be approved for one continuing education credit for nursing home administrators, both skilled and assisted living and personal care, and certificates will be emailed at the beginning of next week to live participants. Several of you are participating in a group setting, and we ask that you register the names of all attendees for credit issuance record, keeping them at some point during the presentation, or reply to the credit email that I send following. All attendees will be in listen-only mode. Throughout the presentation, please feel free to submit questions via the questions pane, and our presenter will address them at the end of the presentation. Our presenter is Murry Mercier, Senior Living Account Manager for PointClickCare. Murry has worked in aging services for over 10 years, and prior to joining PointClickCare as account management team in 2014, Murry served assisted living and memory care communities as an administrator and guide. Murry possesses a unique blend of experience across technology management and long-term care operations, including multiple instances of increased EHR adoption and rollout. Murry, the presentation floor is yours.
Well, thank you, Abby. I'd like to start off by thanking you and the Pennsylvania Healthcare Association for having me on today. Much appreciated. I hope today to go through a conversation relating how we can leverage technology to better our operations in the long-term care space. This presentation is primarily geared towards senior living on the slides, but I'll definitely talk to all lines of business because there is some shared, the topics are shared most certainly across skilled nursing, personal care, assisted living, even into home health, hospice, and so we'll go through a definition of that here in a moment. So there is some irony and misnomer towards the title of my presentation here, Improving Quality of Care Through Technology. The irony is that we will never be able to come up with a system or a computer of sorts that will be able to improve care on its own. But what the focus really is improving communication and leveraging technology to give us the information that we need as individuals and human beings to better the care that we're providing to our residents, patients, and elders living with us in our different types of communities. So thank you for the introduction, Abby. And I do have a slide so you can see my lovely mugshot here. And that's me. I have been working in senior living and long-term care for about 14 years now. My background education-wise was in information systems, and I do have an MBA as well. I'm an Eden at Home instructor, for those of you familiar with the Eden at Home program. I'm also partnered with the Alzheimer's Association as a certified trainer, and I take part in the Colorado Culture Change Coalition as a board member here in Colorado. I do have a rather large German Shepherd sitting next to me, and sometimes he likes to add to the conversation, so please bear with me if he gets a little excited. So our objectives today will be to cover what exactly is senior living, so what is the scope that I'm speaking of inside the presentation. We're going to go through what exactly an electronic health record is, why this would be good for our communities through a number of bullet points, and 9 areas of daily operations that are specifically impacted by leveraging technology to increase quality of care. I'll take a moment at the end to cover the benefit, the cost benefit of looking at technology to implement in the community, and also speak to overcoming some barriers that I've commonly seen in organizations that have decided to adopt more technology into their operations. So senior living, we're essentially providing a home, right? There's all different types of communities out there. There's institutional and clinical care communities. There's households and neighborhoods. There's care being provided in home settings. There's large facilities and there's large CCRCs, and there's single-family homes where people are taken care of and with 3 to 4 residents at a time. We have greenhouses and long-term care facilities. So it is a rather large gambit, but the key is that communication is at the heart of the success of these communities, and that is really what an electronic health record does, is it gives the right people the right information at the right time to make better decisions inside the community and for the residents. I would venture to imagine that a lot of you are using technology today in your communities. You are probably using some sort of electronic health record, whether that's just to collect demographic information, or perhaps you're doing care planning, or you're submitting your MDSs through electronic healthware software, collecting that data and keeping it in one place. I would venture to imagine that you're all using some sort of electronic billing software. And an electronic health record software is meant to pull all of the business functions into one system at your community, or at least provide a centralized area that can be integrated with multiple systems, so that you don't have multiple disparate systems running parallel to one another, sometimes containing the same information that becomes out of date because they're not linked together. You change it in one area, but you don't change it in another. But an electronic health record tries to pull it all together so that you as an organization are entering data one time and giving the correct access to individuals in the different types of communities that need to see that information, depending on their role and position. So an electronic health record is an integrated health record that uses technology to help better manage care documentation, deliver consistent and personalized experience for the elders and residents living in the community, and improve your business processes so that everybody has a clear picture of what's actually happening in the organization at any given moment, and also at a historical perspective, so you can look back at the previous month and the previous 6 months and the previous year and start to see trends. And Abby mentioned the benefit of that piece in the introduction, is if we can begin to get our organizations and communities onto this information superhighway that is electronic health records, we can begin to do analysis and track trends that allow us to see what potentially might happen to our residents. It's called predictive health, right? And we can begin to see what happens to a resident who's experiencing these diagnoses and these symptoms at this stage in their life with this medical history, and it'll begin to assume potential intervention or care plan or service plan items that will help the individual be more successful. And it helps us because we start to see trends and we can better care plan for the individuals in the community, if that makes sense. So why were electronic health records developed? Communication is going to be a repetitive theme today. It really is all about communication, the demand for information. Increasing communication will reduce move-outs and will reduce hospitalizations simply because you're reacting quicker. We're getting closer to a proactive approach using health record systems, and further from the reactive approach that has traditionally occurred inside of these industries. Helping to improve operational efficiencies because you're not chasing paper. You're not chasing information around the community. I know we spend a lot of time doing that. I need to find out what happened. I've got to talk to all these individuals. If you do appropriately use an electronic health record system, you'll be able to see that information at the click of a button on the screen right in front of you. Mobile efforts are becoming increasingly popular with electronic health record providers, where creating apps, just like the rest of the apps on our smartphone, that allow you to access information at the click of the screen. And then, of course, increasing quality of care and quality of life for residents. When you are able to have an interaction with a resident and document personal choice or document personal preference into an electronic health record system that staff has access to, that information is shareable. And any staff member approaching a resident or a patient or a person in the community to have an interaction with them is better geared towards that interaction. And a health record helps to do that. So let's take a little deeper dive into what exactly the electronic health record can do for your organization. Well, it can increase and better the resident experience. We talked about the information flow. Enter the information one time, have it accessible to anybody that needs that information. Let's say a care plan changes because of a resident and family conference. You go in and you change the care plan, and that care plan immediately copies down to anybody else that needs access to that. And they have access to it instead of being in a binder in a back office that's hard to find and hardly accessible when they need it. Clinical and financial workflows streamlined. So imagine instead of the paper process currently of passing assessment conclusions that show levels of care today, that probably traditionally flows through a paper process over to your business office where they then update the invoice. Imagine a single system that ties all of that information together. So as soon as a level of care change occurs in a private pay situation, the business office is automatically notified that that change has occurred, and you can get the correct invoicing and billing in place for that resident. And then decision support. Have more information at your fingertips as a nurse or as a practitioner or as an administrator so that you can make better decisions in a more timely fashion. The EHR supports that. And then at the bottom here we have what's called interoperability. So it's the ability to take the information that's in an electronic health record or take information that's in another third-party software like a pharmacy system or lab results system or pull cord systems, POS systems. All that information can be shared real-time or by file exchanges that are automatically processed from the electronic health record. So you can constantly keep your care records up to date, your billing records up to date, and your demographic information up to date based on the changes in other systems that are tied directly into your electronic health record. So again, this is where that information superhighway comes into play. Population health and health information exchanges, the ability to take care of me if I have an accident in Europe and be able to pull up my medical record based on a social security number so that they can make the best decisions for me at a moment's notice is really where we want to get to as a society. So getting on that highway of electronic health records is going to be the first step in making your data available to the future of what electronic health records will look like and shared information across systems. There's a whole lot that we have to deal with inside of our communities. And so doesn't it make sense that we would use an electronic system that can help better capture, share, and analyze all of the data that you're collecting across so many different areas, whether it's care management, marketing and community engagement, financial management, regulatory compliance and keeping up with changes and keeping up with the pace of those. And service and support, how are you leveraging the community outside? What type of interactions is your organization having with third-party providers and agencies and other home health organizations that are coming in and providing care to your residents? Is all that information tied together in a meaningful way that is actually useful? Or are we just collecting data but it's being put into an environment that isn't necessarily helpful to us, or we're not able to analyze that data? There are a lot of advancements being made in mobile technology. I mentioned that before, but the electronic health record providers often have applications that are able to download from app stores on your iPhone, and the physician can have an app, and the direct caregiver can have an app, and the medtech has their own app. Very intuitive and very much so in the palm of your hand, so that information becomes more and more useful. So big kudos for having to deal with all of these things and keeping track of it all. So here we have this tool that provides functionality that's purposefully built to support your business. How do you drive value? Much of the value is built in. Some you already find, but some will be new. Essentially, you're taking better care of your community, and so your community will take better care of the bottom line. And word of mouth travels really fast. So when you begin to provide great personalized care because you have a high degree of communication with your residents, they're going to leave that community and they're going to go tell people what a wonderful experience they had. And their family members are going to share that wonderful experience with other prospective residents. And that's just going to drive the buzz and drive up your waiting list in your communities. Maximizing profitability is definitely something that comes out of getting all the information in the same place. You're able to better manage the resident experience, and you can do that through several different ways. The first is reducing manual data entry. So currently today, if you're working on either disparate systems or if you're working on a paper system, you have these conversations during the marketing phase and during the move-in phase. Is that information being captured and shared appropriately, or are you then collecting that same information or redundant information at the next phase when the resident moves in and the care staff get introduced? Instead of collecting the same information at multiple points, collect it once and then share it appropriately across your staffing. Managing risk. When you have an electronic system that shows you the documentation and the services that you're providing and the medications that you're delivering, and you're able to pull that up and see, did we get all of our documentation for our whole MedPass put in today? You're going to avoid errors and you're going to avoid missed documentation. And you're going to have transparency into what's actually happening right this second inside of the community. You're able to more easily enforce policies through the automated controls that are in an electronic health record. A good example of this is, how do you like your progress notes completed? What information do you want to collect when it's a move-in progress note or an admission progress note? You are able to tell the electronic health record, this is the information that staff member has to provide. So you limit the gaps because you're using the electronic technology to prompt the employee on what information they need. It can help to alleviate bad habits and enforce good habits and get people into the used to doing things the way that you would like it to happen inside of your operations, which leads to increased operational efficiencies. Collecting the right information at the right time with the right person is key, and oftentimes we run around redoing work, following up on things that we had already followed up on once. Technology, again, can prompt the right information at the right time and reduce the operational inefficiencies that exist. It also improves staff productivity because the information is shared and it's entered once. So when the staff in the morning learn something, that information can easily be passed to the staff in the afternoon, instead of each staff member having to learn the same thing in two separate occasions. We partnered with Senior Housing News to do a survey, and we put it out there to their audience and asked them, first we asked them, what do you think the most critical success factor will be to sustaining your business? And we asked them to rank their responses. And here's what came back. The number one critical success factor that the market identified was creating effective staff recruitment and retention strategies, engaging the staff. I learned very early on, and you probably have a shared experience, that if you take care of the staff who are taking care of the residents, then they'll most likely take care of your bottom line. When staff are out there and don't have the support they need, whether that's in tools, such as an electronic health record, or education, or moral support, they're going to struggle to provide great care, which is going to most certainly impact your bottom line. Instead of families and residents leaving the community saying what a wonderful experience they have, that story changes quite a bit when you have a low staff engagement. So I totally appreciate and was happy to see this come back as #1 priority in the market. Now, ironically, the next 3 sort of impact the #1 priority, aligning staff resources and skills to the different levels of care. We are having to be extremely flexible in the levels of care that we're providing to our residents in every single environment. We're doing things that we haven't done before. We're allowing residents to take more control over their decisions of livelihood and the choices that they want to make and the way they want to live. We're doing more negotiated risk than ever, where we identify the services somebody needs and then they choose to do something different than we might suggest. And it's important that the staff that have to deal with the residents and engage with the residents across such a multitude of different situations have the resources and the education and the skills required to do that. Electronic health records can do that because it's based around communication. So when you have a change and you suddenly need to provide a new service to a new resident and there's very explicit instructions about how you want to do that, you're no longer putting a sticky note on the wall or a sticky note on the time card or writing it in the communication book and hoping that they're all going to read it. You put it in their palm of their hands. So when they log into the technology, the first thing that pops up is an alert to let them know that a care plan has changed, that something very specific needs to occur. That is giving the staff the tool and the education that they need to successfully respond to the changes in our residents' well-being. So, #3, the implementing technology to improve and personalize care. That falls right into the conversation we were just having. And then enhancing marketing outreach efforts. Keeping track of how am I engaging with the community outside of our walls? How am I engaging? What type of interactions are we having and with who? And what were the outcomes? Having that all in a system, again, where you can run analysis and understand we see an increase of move-ins from this area of town. Maybe it makes sense to do directed marketing efforts in that side of town. Keeping track of that information so you're not flying blind was listed as the #4 most important critical success factor. So then we asked everybody, what technology solution do you believe will well enable you to stand out against your competitors? And the #1 response there, I don't think a surprise, is the electronic health record. Again, some irony here is that the electronic health record is all-inclusive or can be all-inclusive depending on the provider. So things like resident monitoring, family portal, customer relationship management, which is marketing, point of care, documenting the services we're providing, all of these pieces are tied directly into this electronic health record. So it really is either it's all-inclusive or it's like a hub and spoke, and the electronic health record is the hub, and then maybe the pull cord system is going to be one of the spokes, but all the information again is shared once you can get yourself onto the electronic superhighway. Now let's take a look at the key drivers of an electronic health record. Some of the things that you might identify inside of your community that could indicate an electronic health record would be beneficial to you. Are you currently running a paper process? And we're going to dig into these pieces a little bit deeper each section. We have the staff engagement on here and how important all of those pieces related to staffing is. A demand for quality of care and ensuring you're delivering quality of care. I call it electronic health records help you follow through on the promises that you gave to your residents and help you keep track of that. Knowing your residents deeply, sharing the information, ability to measure performance, which is so important. Analytics is key. On the skilled nursing world, it's becoming required. And so CMS wants to see that data. Let's look at our hospitalizations. In senior living, let's keep track of our incidents. How many people are falling? Are there Are there nutritional issues that we're seeing? Let's keep track of all this information so we can start to see trends, and we can get into the predictive mode where we're seeing what might potentially happen tomorrow today and identifying change. So if you're currently on a paper process today, you might find yourself in a redundant and duplicative situation where you're writing down the same information in multiple different areas. The electronic health record, one of the core goals of the electronic health record is that you're always only entering information once. So whether you're entering a blood pressure and then you're doing an assessment that requires the most current blood pressure and that tying together, or if you are entering a personal preference during the marketing stage, you shouldn't have to enter in that personal preference again once you get to the assessment stage. That information should just flow over. Electronic health records can help take care of that where paper methods weren't able to do that. Profitability might be an indicator that piques your interest. Do you have multiple methods of payment? Are you skilled nursing where you're receiving a lot of your reimbursement from Medicare? Are you an assisted living that's looking to take part in managed care or ACOs? In those payment programs, do you have a system in place that's capable of understanding that payment method and automating it for you so it does make it worthwhile and you're not spending extraneous amounts of time doing your submissions for reimbursement? That might be an indicator that an electronic health record would make sense for you, because oftentimes those submissions require clinical documentation behind it to prove that you're actually providing the care, right? Especially when we're looking at a managed care situation. Electronic health records can tie all that together so you do have the information and can maximize your reimbursement from the payment source. Staffing, number one core driver, right? So if you're having trouble with your staffing, whether it's retention, engagement, whether it's empowerment, or just general staff morale, the electronic health record, I think, doesn't get enough credit for how much it can drive staff engagement and staff empowerment. When the staff are in control of their documentation and they're creating and entering the information that's driving your resident care planning meetings and driving your submissions for reimbursement, they are really empowered into the process. And that's something that can be leveraged to say, hey, you know, you're in control of this. I'm just here to be the guide as leadership. But whether it's the experience that the resident's having or the information that's being submitted for reimbursement, you guys really are in charge here, and that can do a lot for staff morale. It creates convenience for the staff because they no longer have to try and remember when they're sitting at the communication log at the end of a long shift what interactions they had with 30 different residents. They were able to quickly take an iPod Touch out of their pocket or stop at a kiosk down the hallway and document exactly what services they provided for a resident and how the resident was feeling in that moment. So they were actually able, and they were able to communicate that quickly to the rest of the staff, to the leadership team. Most commonly, the staff want to take great care of their residents, right? So when they have a tool that lets them immediately document the services that they're providing, they're impacting that care a lot more. So if something is happening to Mrs. Smith and she's not feeling as well today, the staff has a tangible thing that they can do to initiate a process where Mrs. Smith will potentially receive better and faster care, and they feel heard. So I can't say enough about how putting tools in place that are efficient and engaging for staff can be beneficial to the community. Demand for quality of care. So if you find yourself in a position where you're taking care of residents that are needing a higher degree of care than ever before, an electronic health record is going to just help you keep track of all of that information. Some of these care routines are very complex and they're being done by staff who might not have formal and licensed medical training. So keeping track of that information is just so important, and again, having it at your fingertips so you're able to see changes before they become problems is, again, just so important. Analytics. Analytics is really on the rise. Like I said before, CMS is now requiring analytical data and analysis from the care that you're delivering and what's happening to the residents in your communities. It's only a help to us on the senior living side and in the assisted living world, because again, if we can get to a point where we're actually making proactive suggestions to a resident's service plan or care plan or way that, or habits they've built that could potentially negate a negative outcome or at least push it further out, is going to put us in a better place. It's going to put your businesses in a better place. It's going to make you feel better because you're taking better care of the residents. But we can't do that unless that data is in an electronic system and that data is good. So in order to ever to get a benefit out of the data you're collecting, it's not going to help you on a piece of paper. We got to get into a system that's capable of analyzing that for you. So, quick summary of the key benefits: save time and money, ensure compliance because everybody's following the same processes and prompts inside the electronic system and you can see it real time, and give the residents a better experience. Follow through on the promises that you made. I'm going to run through a quick look at how electronic health records, how electronic resident records really impact 9 key daily operations. This is primarily geared towards the senior living, but I think you'll see a comparison that works really well inside of skilled nursing and long-term care communities. So what I would call the big 9: marketing, business office management, direct care, wellness coordination or nursing, engaging with our physicians and practitioners, activities in life enrichment, dining services, administrative community oversight, so for the executive directors and administrators, excuse me, and the resident experience. So a day in the life of marketing using an electronic health record means several things for you. It means that you have one system that you can access via computer, via cell phone, via tablet, that helps you track your leads. What was the last communication that I had with a potential resident? What was my follow-up assigned to that? Did I schedule for my information packet to go out in the mail immediately after having my first conversation? Did I schedule that tour with a follow-up? Keep track of those things so that you don't have to remember and rely on a day planner or separate calendars. Have a system that prompts you to do the next thing that you want to do and to follow a process. Also, collect information a single time, store your documents, and have access on the run. Now that resident has decided to move in because they went through such a succinct marketing process with you and they were really happy with all the questions you asked and all the things that you did to engage them in the community that they've chosen to make a home. And so now you've got to get the contract over to the business office, and normally that might be walked over by somebody, but with an electronic system, that information can automatically flow. You notify the business office this person is moving in. They can set up the demographic information or pull it over if it's already been set up. They can set up the monthly reoccurring charges based on the care assessment that we'll get to in a second. Maybe you have additional a la carte fees that you allow residents to make use of, like extra housekeeping or extra laundry service. Set that up automatically so that when the services are rendered, it does automatically show up on the invoice instead of keeping track of it on paper and always remembering to send an email to the business office and saying, hey, this person got extra laundry. Tie that all into one system so that you're maximizing your process there. Keep track of collections. What outstanding revenue do I have sitting out there? How long has it been there? Has it been there more than 180 days and I need to write it off? Are we getting paid from Medicare and Medicaid appropriately? What's my daily payment average from private pay and managed care. See all that information broken down. You probably don't have insight into that unless you're using an electronic system that collects and analyzes that data. Electronic health records do that today. Automate your annual tax letters, automate your annual increases and apply it to the appropriate apartments. Use the efficiencies that are built in the system to help you use mass change efforts without taking hours and hours of your time to do so. So the resident is moved in, they're in their apartment, and the new direct care partner is coming into the apartment to help them get dressed in the morning. They've never met this person. But this person knows who they are because they've seen the service plan because it was in the palm of their hand or on the kiosk out in the hallway. They're able to see that Mr. Jones served in the military, and you are able to make a connection more quickly because you're about to do something very personal with somebody. And if you have no knowledge about that individual, or you haven't taken the time or had access to the information that might give you that knowledge, that experience isn't always comfortable. So gear the direct care staff with the information that they need to take the right steps in caring with the residents that they're about to serve. I talk a little bit again about staff accountability, ownership, engagement. They own the documentation process. They are the starting point for information flow into your organization. If something is changing or something is different, they're the ones that initiate that process. So they have ownership. It really empowers them in their positions. Document tasks quickly and directly to the chart. You may be using printed task sheets right now where they may or may not be making notes and checking off boxes and then putting it into a box or a folder at the end of their shift that we probably aren't going back to unless there was an incident. They can now put this information using an electronic health record directly onto the chart, so that information becomes useful and valuable to you. Instead of, in the community, I would see a direct care partner delivering a service to a resident, and that wouldn't be familiar to me. I know it wouldn't be on the care plan, and I would say, oh, how long have you been doing that? And the care partner would say, oh, I've been doing this for maybe 2 weeks with them. And then I'd go over to the wellness office and say, oh, how long do you know that the service is being provided? And they say, oh, yeah, we've been doing that for a couple days. In the meantime, we might have missed a key point of deterring a change in condition. We might have missed a point in alleviating stress or pain to the residents sooner, simply because the communication systems weren't in place to help me understand what was happening in that moment at that time for that resident. The electronic health record can take care of that, and that's one of the coolest parts for me besides staff engagement, is that I would be able to see immediately when something is documented for a specific resident. I would immediately be able to see that on my dashboard, which is a bit of a change since we are so used to reactive operations inside senior living and long-term care. The electronic health record really flips that around, so I can become more proactive, or at the very least respond immediately to changes as opposed to waiting any amount of time for that change to become potentially worse. So here I am, I'm the nurse in the wellness office and the nursing office, the DON. Now I have a tool for daily work. I have a dashboard that shows me what assessments do I need to complete today because they're on a regular schedule. What information has been documented by the direct care staff that might insinuate I need to go look at a resident or have a conversation or pick up the phone and call the family member so I can speed up the communication and potentially deter a negative outcome. I can see at what point are my direct care staff at in their services for the day. Oh, Sally has documented 55 out of 60 tasks for today. That's great. She's moving along her day. And Mark has only documented 5 out of 50, and we're getting towards the end of the shift. I wonder what's going on there. So we can catch training needs with the staff Maybe it's a staff morale issue. Maybe somebody's having a rough day, but I can actually identify that in the moment instead of potentially something bad happen to identify that for me. I'm able to track medications in real time so that I can see where is my staff in their medication delivery rotation. Create thresholds for notification, so when staff are doing their monthly weights for residents and somebody's weight has changed 4 or 5 pounds or whatever the threshold is for them, I immediately get notified. Again, shortening the period of communication. Have remote access so that when I get a call from a staff member in the middle of the night, I'm not simply just making a blind decision, but I can actually go in and look at the information real time to make the best decision. Do I need to go in? Should I just suggest an intervention for the time being, or do I potentially need to contact the practitioner and get a new order in place? And better decision making, obviously, because more information at your fingertips is going to lead to better decision making for you. For the physicians and practitioners, they could potentially utilize the electronic health record as well, logging directly into the chart, having, again, that tool for daily work, so they have the dashboards of the information that they need to see. So-and-so went out to the hospital last night because of whatever reason. So-and-so is coming back tomorrow, so we need to get orders in place. A lot of times these electronic health records also have internal communication tools so that you can send HIPAA-compliant messages and text messages from the chart to the practitioner or to the staff member that you need to get in contact with, and that obviously alleviates the worry that your staff are using normal text messaging to communicate, because we know it happens. We hope that it's not putting our organization at risk, but you can really tie that up if you do have a tool that gives the staff the ability to communicate in the manner that they need to communicate in at that time. So communicate with the physician. A little anecdotal story. Practitioner engagement is the module that PointClickCare offers related to this, and one community that I worked with that adopted that functionality down in North Carolina, their average response time from practitioners was 35 minutes, from the initial time that they would contact the practitioner till the practitioner responded. When they implemented practitioner engagement, which gave the practitioner the ability to access the chart from their cell phone and reply with a HIPAA-compliant text message, their average response time dropped to 1 minute and 15 seconds, which was really cool to see, and ultimately just ends up in better care for the resident, staff knowing what they should do, and staff feeling like the resident's getting exactly what they need in a timely manner. Electronic health records for practitioners allow them to do direct order entry, direct progress note entry, and to provide electronic signatures. So you no longer have that delayed time for telephone orders if you need that in your community, if you don't have a nurse on staff that can take down a telephone order, so you're always waiting for a fax. That eliminates that risk from being there, so you can take care of those issues in a much more timely manner. Activities and life enrichment, so important, and from long-term care to senior living to home health, holistic care plans are becoming more and more popular and more meaningful. So why not have that information also included inside of your electronic system? Use the information to look at activity attendance and activity preference. Start to see changes. If Bobby Joe always comes to crocheting and she just missed the last 3 days of crocheting, that's another communication tool that can be used to indicate potential change in condition and get ahead of things faster, right? That's the key behind all of this, is let's communicate quality quicker. Same thing into dining services. Whether or not you use therapeutic diets, you still want to acknowledge and do your best to meet the personal preference of the residents' dining preferences. So why not also use your electronic health record or electronic resident system to track that information, to share it from the care side over to the dining side, if you are in a situation where you're using therapeutic diets and you need to share that information via orders, you can also use the system to do that. Getting the information to the right person at the right time for the right reason. And then as an executive director or an administrator sitting behind your desk and you get the phone call and they say you're not providing this service to mom, or she just called and they're not brushing her teeth and they're not giving her a shower, have the information at your fingertips. Think of how much more meaningful that conversation can be if you can pull up the direct care documentation right in front of you at that moment of time and have something to discuss. So often the answer has to be, oh, I need to go look into that, and then I'm trying to find the employee who potentially delivered that service and they've gone home for the day. And they're not responding to phone calls. Now I'm waiting a whole another 24 hours and I haven't given any sort of response to the family member. It's not always an easy conversation, right? Technology doesn't make the conversation necessarily easier. Well, it does in that it gives you data that can support you in your conversation. It can help you have the conversation quicker so things don't escalate as much as they could, because we know that silence over long periods of time tends to cause escalation in individuals. So have the information right in front of you. Predictive analysis comes into play here. I always think about my monthly incident management meetings and how much easier that would be if I had the analytics and the electronic tools behind me to show what are the incident rates this month. Have I seen a spike? Is there an area of my community that tends to have more incidents than others? Why is that? I can start to see patterns. It's really hard to figure that out without having that data in an electronic system. Get in and out of the weeds quickly. Like I said, you have really good transparency all the way from the highest level of the organization all the way down to an individual care partner delivering an individual care need to an individual resident. So really cool at the click of a finger. And then finally, and most importantly, from the resident's perspective, the electronic health record system can most certainly be used as a marketing tool, and as long as you're using it correctly, the residents will quickly see the benefit and they'll trust that everybody is seeing the right information. They're not I mean, how often do residents have to tell staff repeatedly over multiple shifts a change that is happening with them, and we're not, now I need 2 people to help me take a bath or whatever it might be. Get that information into a system that's accessible by everybody, and the resident will feel that difference. They'll trust that everybody's seen that information. Have transparency into care. Include the resident in the documentation process. Include them in the trends over time. Include them in the conversations. The electronic health record can be a means of inclusion. That information doesn't need to be kept secret or separate from the resident's eyes. They should most certainly be engaged in that. Keep information organized in case of questions. My mom's lost a ton of weight this year. Okay, let's pull up her weight over the last 12 months and let's really get a good idea of what this looks like and do that really quickly. Spend more time on with the resident, spend more time on the resident relationship, less time on documenting tasks, and you can now document the tasks with the resident as opposed to going into a room and shutting the door and taking down the book and documenting all of your notes separate from the resident. Ultimately, it just helps them find a home. So I'll take a minute here to look at the cost benefit. Really, if you're dealing with any issues around resident satisfaction, your reputation, if you're using paper, the cost of paper, if you have a high level of turnover, we think about each direct staff turnover is about $25,000 to our organization. If we have 10 of those in a year, then we're looking at $250,000, and that's a lot of money. So getting systems in that can help reduce that is going to be worth it on its own. Are you struggling with surveys and tags? Those are obviously going to cost you money, and an electronic system can help clear up any of the operational processes that might be causing those survey issues and costing you time and money. Administrative hours, for example, are you spending 2 days of staff time at the end of each month to do an EMARM audit, and comparing the order to the prescription to the medication bottle? That goes away when you have a electronic system doing that audit for you monthly, printing out a report and having the physician sign it. Right there you saved 2 days of labor. So it compounds the more you look at each thing. If it can help increase your occupancy, training staff, overburden staff, get insight into how many tasks and how many services is one staff member completing against another. Do I have some weak links or some gaps that I need to provide some education to? The cost benefit really adds up here. Okay, so overcoming potential barriers. This always comes up when making changes to systems and communities. And the thing I equate it to is, remember when Starbucks changed their cup to the plain red cup last year and how bonkers everybody went? And this is just the cup where my coffee sits. Think about changing an entire system, an entire way, an entire mantra towards the way we do things. Staff are so used to getting the communications that they get, and they're so used to being frustrated that they are skeptical to adopt a new way that is potentially frustrating as well. So change management and rallying the troops and being prepared for a project of system change like this is oh so important and cannot be understated. This isn't something that we can just kind of do on the side and it'll all go well and it'll take care of itself, because I've certainly seen it go the other direction for organizations that have been unprepared. So when I'm thinking about being prepared for a system adoption, what do I need to think about? Well, the first thing is funding, and you need to look at what are my hard cost savings going to be in adopting this system, so I can begin to understand what my return on investment is going to be. How much money am I going to save on paper and supplies and binders and space to keep all that information and medical record archives and that type of thing. And then look at your soft cost savings. What efficiencies am I going to be able to find in process? How much time do I spend doing something right now on paper that will be lifted and eased using an electronic system? And then budgeting this by phases. We're so used to, when we think of software and we think of something like Microsoft Word, we buy it, we install it, we use it, and then that's it until we buy the next Microsoft Word, right? Well, in an electronic health record these days, they're almost all cloud-based, and it's what you call software as a service. I will touch on that a little bit more in a second. Having a hardware plan. So making sure that you understand, okay, if I'm going to ask my staff to use electronic systems, then I have to give them the tools that allow them to utilize that system. So understanding what's the mixture of desktop computers, laptop computers, tablets, handheld devices. Again, the benefit of a cloud-based software as a service is it's not necessarily device specific. You simply need a device that's connected to the internet. And then you can just use web browsers to access the system. There are hardware partners out there. Just like software for a service, we now have hardware as a service. So instead of buying the equipment outright, you simply subscribe to the hardware service and they take care of everything else. Leasing options, making sure you're planning for expansion, whether you're adding buildings or maybe areas of your community, understanding what the infrastructure needs. When you do use cloud-based services, you've got to maintain an internet connection as strongly as possible. So having backup connections for your infrastructure, making sure that one is fiber and one is cable so it's not running down the same line, and then doing an infrastructure and wireless architecture layout. So if you are going to use wireless on laptops for medication delivery or something like that, making sure staff have access to the wireless from one wall to the next. And then having a disaster recovery plan in place. The electronic health record providers do have manuals already for disaster recovery plans that the client organizations use to put in place for their standard operating procedures. Like I mentioned, it is software as a service. It's a huge convenience because it's pay as you go. You simply pay a subscription fee. Instead of paying $50,000 for a software suite or $100,000 for a software suite, you just subscribe to the software month over month. The good thing about that is that the software provider hosts the application, so all of the maintenance and upkeep of the servers and patching and all the technical mumbo jumbo gets taken care of by the software provider. And you simply connect, and they're responsible for every other piece of it. That also helps to move the functionality forward faster because the organization that is providing the electronic health record is able to spend more time and more resources at building stronger partnerships with other software service providers. Electronic health records can't be all things to all people, but they have the time and the resources to engage with the experts in each individual area of software that you leverage in your community today. We talked about gaining staff buy-in. I cannot understate this enough. The best organizations that I see getting through software adoptions, and mind you, software is not perfect, it never will be, and it can't replace humans, it simply gives us better tools, right? But the most successful organizations are the ones that prepare the staff for the change. And 6 months before we do any sort of configurations, they go in and they say, hey, here's the system we're going to adopt, here's the benefit it's going to bring, we don't want this to be a surprise, and get feedback. And then go back in and have a project rollout plan. Here's how we're going to take care of staff that have more technical needs than others, or maybe suffer from any sort of learning disability, or struggle to read, or English as a second language. Let's get ahead of all of those things. I never want the adoption of technology to deter a staff member from wanting to come to work, especially a good one, right? So we got to be aware of that. Let's find our champion super users, the ones who are going to be the cheerleaders, and let's also identify the naysayers, and how are we going to approach them, and how are we going to deal with that so that it doesn't become a detriment to the project. So I can't say enough about the staff buy-in. I had one organization that actually went through all the demos for all the different electronic health records, and they were the deciding factor of who moved to the second phase of choosing electronic health record, which is really cool. So save time and money, ensure compliance, and have a better resident experience. Electronic health records can support that. They can't do it all on their own, but they can heavily support it. Right now, this is what I consider the 6 core senior living workflows that technology really has the ability to support right now. Marketing in customer relationship management and keeping track of referrals and potential residents. Service package management, which is the ability to have a really good move-in assessment, a really good service plan assessment, have that tied directly to billing, and also have that tied to the direct care documentation process. The care delivery documentation process itself, so how easy it is for staff to document the services that they're providing, progress note structures, the incident management process, and orders management in EMAR. So if I were to suggest a starting point, it would be one of these 6 areas. But certainly consider your organization, where are your pain points today, and this doesn't need to go any one specific way. You can look at what's important to you and execute a project plan from there. Okay.
Great,
So
thank you so much, Murry.
Yeah.
At this time, we'll open it up to questions. I'll leave it open for 1 or 2 minutes. You can use the pane on the right-hand side of your screen to submit them, and we'll wait a couple minutes to see if there are any.
Quiet group. I hope I didn't put them to sleep.
No, you were just so thorough. It was good information. All right, well, no questions. So just a reminder, your certificates will be emailed this time at the beginning of next week. We have some events going on here at PHCA. A recording of today's presentation will be made available at phca.org. Please feel free to share that. Thank you again to our speaker, Murray, and PointClickCare for this presentation. This concludes today's webinar.